Good afternoon, ladies and gentlemen. We shall now proceed with item number 7, awards. Excellencies, distinguished delegates, ladies and gentlemen, we are assembled here today for the presentation of prizes awarded to individuals or institutions for outstanding achievements in general health development. We shall now proceed with the presentation of the Sasakawa Health Prize. It is with pleasure that I announce that the 2015 Sasakawa Health Prize has been awarded to Childbirth with Dignity Foundation of Poland, represented by its Chief Executive Officer, Mrs. Joanna Pietrusibich. I invite Mr. Yohei Sasakawa, WHO Goodwill Ambassador for Leprosy Elimination, Chairman of the Nippon Foundation, to address the Assembly on behalf of Sasakawa Memorial Health Foundation. Sir, you have the floor.
President J.P. Nanda, Dr. Margaret Chan, Director General of the World Health Organization, honorable ministers, distinguished guests, ladies and gentlemen. Let me begin by congratulating the Childbirth with Dignity Foundation for winning the 31st Sasakawa Health Prize. I would also like to convey my deep appreciation to the Sasakawa Health Prize Selection Committee for your understanding of what the prize is aiming for and your careful consideration and neutrality in selecting this year's winner. The Sasakawa Health Prize was established in 1984. This was a time when the WHO was pushing forward the Health for All initiative under the Declaration of Alma Mater. Against this backdrop, the Nippon Foundation established the Sasakawa Health Prize. It was our wish to recognize individuals and organizations that have made a positive impact on people's lives or an outstanding contribution to the field of primary health care. The prize also aimed to encourage the further progress of their activities. The Childbirth with Dignity Foundation has been engaging in actions at the grassroots level that meet the WHO's key element in primary health care for better health for all. Their work includes making information on hospitals accessible to pregnant women so that they are able to make more informed decisions, helping medical institutions reform their service delivery toward pregnant and nursing women, helping women to defend their rights during pregnancy and child raising by offering legal consultation, and raising public awareness for greater respect toward the rights of women in places such as hospitals and the workplace. All of this will be explained in detail shortly after by the Foundation. But as you can see, their grassroots activities are not just improving the environment for pregnant and nursing women, but also empowering them to take ownership of their issues. We, the Nippon Foundation, are proud and grateful to have been able to recognize such and other important grassroots initiatives through the Sasakawa Health Prize for over 30 years. Under the strong leadership of Director General Dr. Margaret Chan, WHO is committed to meeting the challenges of global health with the active involvement and collaboration of stakeholders from all layers of society. One of the important stakeholders in this global initiative are people who are working day in and day out at the grassroots level to help their communities achieve better health. As for myself as WHO Goodwill Ambassador for leprosy elimination, I have seen with my own eyes the positive changes that our local NGO partners have been making to the lives of leprosy patients and their families who are living in remote villages and urban slums around the world. I strongly believe that nurturing such activities will help speed up our path to achieve a better health for all. So, this is my request to all of the delegates here who are representing your country's health ministries. Please seek out individuals and organizations that are making a difference in their communities through primary health care and giving them encouragement. We, the Nippon Foundation, are committed to maintaining a place to publicly recognize these unsung heroes and their amazing work. It will be the inspiration to push the rest of the world to action. Finally, I would like to once again congratulate the Childbirth with Dignity Foundation and wish them continued success on their important endeavor. Thank you very much.
Thank you very much, sir. It is now my privilege to present the Sasakawa Health Prize to the Childbirth with Dignity Foundation of Poland.
Ladies and gentlemen, let me express my sincere thanks to the founder of the prize, the Sasakawa Memorial Health Foundation, to the members of the selection panel and the executive board for their decision to award our organization. I would like to thank all the people who have ever worked for our organization. For 20 years, we have struggled for the respect and dignity in childbirth and to enable women in Poland to decide where, how, and with whom they will give birth to their child. We provide women with relevant information to help them make a conscious choice. We have built the website Gdzie rodzić info, where to give birth.info, to publish the official statistics and information submitted by hospitals. Women can evaluate the quality of care and share their experiences. We believe that by making the women's experiences public, the perinatal care will improve. We hope that this voice will be heard. Actually, this is happening. We struggle for the transparency and access to the public information. It was not easy path. Nobody in Poland wanted to finance that project. The hospital refused to give information. We have raised the money ourselves and have taken legal action to gain the data. We have won. Our website is visited by 100,000 people every month. Our aim is to achieve the healthcare based on friendliness, professionalism, empathy, individual attitude, respect for the women's needs and their choices. This award is also for all organizations that struggle for the care respecting human rights and focusing on the mother and child, because the way we are born into this world influences our whole life. Thank you very much.
Thank you very much. Thank you very much. We shall now proceed with the presentation of the United Arab Emirates Health Foundation Prize. It is my pleasure to announce that the 2015 United Arab Emirates Health Foundation Prize has been awarded to Akogo Foundation of Poland, represented by its President, Mrs. Eva Blasik. I have now pleasure in inviting Dr. Hossein Al-Ran, Assistant Under Secretary for Health Centers and Clinics in the Ministry of Health of the United Arab Emirates, representing the founder of the United Arab Emirates Health Foundation, to address the Assembly. Sir, you have the floor.
بسم الله الرحمن الرحيم. سعادة الدكتور جاد ندى رئيس الجمعية
In the name
العامة
of God, the compassionate and
لمنظمة
merciful,
الصحة العالمية.
President of the World Health Assembly of the WHO, Madam Director General Margaret Chan, Regional Directors, Your Excellencies, Health Ministers, Your Excellencies, members of delegations and representatives of participating organizations, ladies and gentlemen, I would like to extend a warm welcome and hope that the blessings of God are with you. On behalf of the United Arab Emirates Health Foundation, I would like to pay tribute to the doctors and scientists, the researchers and healthcare workers, and thank them for the excellent work that they do in the name of health. I would like to thank all of the members of the Executive Board of the WHO, and their efforts are praiseworthy. On behalf of the United Arab Emirates and Sheikh Khalifa bin Zayed, who also greatly appreciates the work of the WHO, we have created the United Arab Emirates Prize in order to reward those who fight and win, who make progress in health, who dedicate their work to the health of people. The prize, which was created in 1995, has been awarded to 44 individuals, organizations, and healthcare institutions throughout the world. We've supported a number of charitable organizations in many different countries. So I am proud today to be able to announce that this year's prize winner is Akogo from Poland, which provides holistic health to those children who have found themselves in a coma in Poland. We think that this organization's contribution, together with the Ministry of Health in Poland, in a particularly difficult area, is an extremely noble endeavor for a very vulnerable part of the population, namely those children in a coma. In awarding this prize, the United Arab Emirates hope to further encourage researchers and scientists in their efforts to enhance ongoing efforts towards greater effectiveness in our work, greater effectiveness in overcoming the challenges we face. So once again, allow me to say to all of you in this hall that it is with great pleasure that we award this prize to Akogo. We will continue our efforts to assist in anything that can help humankind as a whole. Thank you very much for your kind attention.
Thank you very much. It is now my proud privilege to present the United Arab Emirates Health Foundation Prize to the Akogo Foundation of Poland.
Madam Director General, Mr. Chairman, Regional Directors, Honorable Ministers, ladies and gentlemen, I would like to thank you profoundly for your help and support. The special thanks goes to the United Arab Emirates Health Foundation, the sponsor of the prize. I would also like to thank members of the selection panel and members of the executive board who granted us that award. The Akogo Foundation established the systemic solution to coma problem in our country, Poland. Together with the Polish Ministry of Health, we created a medical program to wake up children from coma in phase B. We have also built the first model clinic for children in coma. The clinic is a part of the largest children's hospital in Warsaw, Children's Health Center. Alarm Clock Clinic was opened in July 2013. It can house 15 patients and 19 children patients have already woken up there. The World Health Organization Prize is extremely prestigious and will help us obtain further international grants. It will also help our foundation to be more recognizable and credible. Once again, on behalf of the Akogo Foundation and all the children who will definitely wake up from coma, thank you once more from the bottom of my heart. My greatest thanks to all of you, to whom the problem of coma is equally vital. Thank you.
Thank you. Thank you very much. It is now my privilege to present the State of Kuwait Prize for Research in Health Promotion to Dr. Ala Ildeen Muhammad El Gamrawi of Egypt. I invite the representative of the Foundation, His Excellency Dr. Ali Saad Al Obaidi, Minister of Health of Kuwait, to address the Assembly on behalf of the State of Kuwait Prize for Research in Health and Promotion. Your Excellency, you may start.
Thank you. معالي السيد جاغات باراكاش نادا رئيس الجمعية الصحة العالمية 68
Mr. President,
مدير العام لمنظمة الصحة العالمية
Director General of the WHO,
معالي السادة الوزراء
Vice Presidents of the Assembly, Ministers, Heads of Delegations, Country Representatives,
يطيب لي أن نلتقي اليوم
ladies and gentlemen. It is a great honor for me today to be here at the WHO Assembly to celebrate the awarding of the prize of Sabah al-Ahmad for the state of, from the state of Kuwait to encourage health and to thank Dr. Margaret Chan, the Director General of the WHO. I would like to thank her staff, her team, the Secretariat for the organization to promote health at the global level. I would like to warmly congratulate the winner of this prize for the research in the area of healthcare with a view to improving the health of individuals. I would like to pay tribute to Mr. Aladdin Al-Gamri from Egypt. He has made a significant contribution in promoting rheumatic heart disease care. The purpose of this prize is to stress the importance of health and the promotion of health. We must recognize the considerable achievements in the area of health that enable all to enjoy excellent levels of health throughout their lives. This is our common cause. This is what brings us here today. This prize was created in 2004, and today we celebrate the awarding of the 2015 prize. It is an excellent testimony to the cooperation between Kuwait and the WHO. It reflects the commitment of the state of Kuwait in supporting the work and decisions of the WHO, something we have always done for as long as we've been members of this organization. A number of humanitarian medical initiatives taken by Kuwait reflect this commitment in the area of humanitarian and health emergencies. We want to stand by your side in all corners of the world to face these challenges. The state of Kuwait is extremely proud to participate in your laudable effort in the EMRO area in order to work to meet the health challenges here and in the rest of the world. We fully support the process towards the regional meeting in EMRO. We very much hope that we will achieve our objectives and strengthen the healthcare systems in EMRO countries. So to conclude, I would like once again to pay tribute to and to congratulate the winner of the State of Kuwait Prize. He has worked hard to promote the health of individuals. May the blessings of God be with you, and may we all work together to see health progress throughout the world. Thank you.
Thank you very much. It is now my privilege to present the State of Kuwait Prize for Research in Health Promotion to Dr. L. Gamrawi.
بسم الله الرحمن الرحيم السادة المنصة
In the
الكرام
name of God, the merciful and compassionate,
السيدات والسادة يسعدني أن أكون بينكم
Mr. President, officers, ladies and gentlemen, it is an honor to be here with you today and attend this ceremony and receive the State of Kuwait Prize for Research in Health. I would like to extend warm greetings from Egypt. I would like to pay tribute to the WHO and also express gratitude to Kuwait for promoting research in health throughout the world. Allow me to thank the ministers as well who've supported the program of rheumatic heart disease, which has benefited health in Egypt. My experience in protecting the health of young people and children in rheumatic heart disease began in my village with a team of doctors. We began in 2003 with the support of civil society. The number of operations that we were carrying out, open heart surgery, was increasing, and we saw that this was because of rheumatic heart disease. We conducted early detection tests amongst children in schools, in slums, and carried out this program for 2 years in the neighboring towns and villages. And then the Ministry of Health in 2005 recognized just how serious this situation was. It recognized the magnitude of the problem and established a national control program in cooperation with the WHO. On the basis of the success of our initiative, it began to train doctors to cooperate with civil society, and we created specific centers for the treatment of RHD in Egypt. We also organized health missions, and the result of that is recognition at the national and international levels. Other countries have invited us. We've had the support of the Global Heart Federation. So the Egyptian program sets out to help 30 million children from 15 to 25. We wish to help those who fall victim to rheumatic heart disease. We support them in these operations, which without our help would cost them huge amounts. We have seen a drop in the amount of open heart surgery, particularly for RHD, and we're seeing that the spread of the disease is slowing. So it's a real honor to accept this award. It's an honor for the great people of Egypt, and it's an honor for the team that is here with me. Thank you very much indeed.
Thank you very much. We will now proceed with the presentation of the 2015 Dr. Lee Jong-wook Memorial Prize for Public Health. It is my pleasure to announce that the 2015 Dr. Lee Jong-wook Memorial Prize for Public Health has been awarded to the Thalassaemia International Federation, represented by Dr. Androla Eliferio, I shall now invite Dr. Soo Koo Lee, President of Korea Foundation of International Healthcare, to address the Assembly on behalf of Dr. Lee Jong-wook Memorial Fund.
Honorable President, Your Excellency, Madam Director General, Dr. Margaret Chan, honorable delegates from the member states, laureate of the 7th Dr. Lee Jong-wook Memorial Prize, Thalassaemia International Federation, and ladies and gentlemen, as President of the Korea Foundation for International Healthcare, I am honored to join the World Health Assembly and to pay respect to the late Dr. Lee Jong-wook and the winner of his Memorial Prize. The 10th anniversary of Dr. Lee's passing is already closing in. As you know, he was a man of action, and his famous saying of do the right things in the right places and the right way is still alive as a motto in the lives of many of us. To honor his spirit, the WHO and our foundation established Dr. Lee Jong-wook Memorial Prize for Public Health in 2008. From the first laureate in 2009, 2 individuals and 6 organizations have been awarded until 2014. The COPI has pleasure in awarding a memorial prize in Dr. Lee's name to those who share the same spirit with him. Let me proudly introduce this year's laureate. The Thalassaemia International Federation of Cyprus was established in 1987 as a non-profit and non-governmental organization with the view to improving the survival and quality of life of patients with thalassemia. The TIF empowered patients and their families with support mechanisms and developed the national control programs for prevention and clinical management of the disorder. It contributed to the development and dissemination of reliable, evidence-based information for the health specialists, patient groups, and communities. It also successfully produced and promoted guidelines and resolutions at the national and international levels. As a result, the history of the main hemoglobin disorders, namely thalassemia and sickle cell disease, has completely changed. Let me invite you to congratulate the proud winner of the 2015 Dr. Lee Jong-wook Memorial Prize. And I hope this ceremony can allow all of us to cooperate toward the global fight against the disease. Thank you for your attention.
Thank you very much. It is with great pleasure that I present the 2015 Dr. Lee Jong-wook Memorial Prize for Public Health to the Thalassaemia International Federation.
Madam Director General, distinguished chairpersons, honorable ministers, country representations, and delegations, ladies and gentlemen, the Thalassaemia International Federation's success since its establishment in 1987 undoubtedly underlines and demonstrates the significant impact of patients' parents' organizations on the promotion of policies and programs, disease-specific but also public health-orientated ones. The holistic management and prevention of hemoglobin disorders stretch across many medical and scientific disciplines, and as genetic diseases lead to extensive social and economic repercussions if left unaddressed. Patients' parents' associations have long recognized their instrumental role in the development and implementation of disease-specific control programs, both as supporters of governments, but also as motivators leading to new initiatives. The empowerment of patients and parents across geographic, cultural, religious, social, and linguistic borders, and their transformation into equal partners with national and international health bodies has been a major success and will continue to constitute our main focus of work. TIF is very privileged to be working in official relations with World Health Organization since 1996, promoting and contributing to many of its programs, disease-specific and public health ones, as an important pillar of our activities. The major health-related objectives nowadays, ladies and gentlemen, are the development of patient-centered healthcare systems and the achievement of health equity. Therefore, the collaboration and partnerships of non-governmental organizations like TIF, Thalassaemia International Federation, with official national health authorities, with governments, and with official health bodies such as World Health Organization is of paramount importance. The board of Thalassaemia International Federation and the global hemoglobinopathy family stretching across 63 countries worldwide today, on this very special occasion, express their sincerest appreciation and gratitude to all those who have shown confidence in TIF's work and have recognized its impact and value clearly reflected through the receipt of this prestigious award. We as TIF remain committed not only to continue, but to upgrade the international momentum around hemoglobin disorders and public health through strengthening our work and our contribution to the relevant programs of World Health Organization. Thank you very much.
Thank you very much. This concludes our consideration of item number 7 of our agenda. I would like to remind delegates that the next plenary will be held tomorrow, Friday morning at 9 a.m. to consider item number 6, Executive Board election, and item number 8, reports of the main committee. The meeting is adjourned.